So welcome again, everyone, to our Know Your Air updates from the Healthy Air Network. Um, we have today a fantastic panel of our partners from the Healthy Air Network. I'm Sarita Hudson, Senior Director of Strategy and Development at the Public Health Institute of Western Mass. And we'll have our panelists introduce themselves as we go around. So I'm going to pass it over to Francheska Bermudez.
Hi everyone, I'm Francheska. I am the program coordinator for Healthy Air Network, and I will pass it to Billy.
Hi, Billy Spitzer from the Hitchcock Center for the Environment in Amherst. We're an environmental education organization. I will pass it to Chrissy.
Hi, my name is Chrissy Larson, and I'm a senior educator at the Hitchcock Center in Amherst with Billy, and I will pass it to Destiny.
Hi everyone, my name is Destiny Gonzalez. I'm a program associate at Health Resources in Action, and I'll pass it to Geri.
Right down the line, I love it. Good morning, everybody. Or yes, good morning, good afternoon. I'm on West Coast time. I'm Geri, my pronouns are she, hers, and I'm a senior program manager at Health Resources in Action and help lead the Massachusetts Asthma Action Partnership, which I'll talk about a little bit later on. Good to be here.
Yeah, thank you everyone for coming. I've spotlighted our speakers, so in the recording, only us will show up, so don't worry about that. To start, we have a jam-packed agenda, but hopefully all good, interesting topics that you guys are all here to listen about. We'll introduce who we are, what we do shortly, and some updates. Talk about how we expanded over the past couple months, and some reports to look at. We're going to talk about some data from our local air sensors, impact on funding, air quality legislation, and then wrap up. Feel free to use the chat if any questions populate as we go through the presentation. But to start, if you are unfamiliar with Healthy Air Network, we are a network of community residents, organizations, public health professionals, and municipalities focused on air quality across Massachusetts. We really believe everyone has the right to healthy air and a safe environment. So we host these low-cost air sensors, outdoor air sensors across Massachusetts that are monitoring air quality. We recently redesigned our website. So if you check it out, it's now more user-friendly, more engaging. There's more pictures and colors. And there's more resources to help the community stay informed about air quality and any air quality related alerts. So feel free to check it out. Some exciting news is that Healthy Air Network will become an app where you can download to a mobile device. This is just our first prototype that was recently shared with us. So here's a view of that, and we've gathered some input from residents and partners, and we're on our way to make a second prototype with that feedback. So we're hoping to launch late spring 2026 or early summer. So be on the lookout for that. And now I'm going to pass it off. Well, we talked about network expansion. And so initially when Healthy Air Network started up, we were more focused on Hampden County, Holyoke, and Springfield with, high rates of asthma and local air pollution. So in the teal, you'll see where our sensors started to grow. But last year, we've done some more expanding up in Franklin County, thanks to our partnership with the Hitchcock Center for the Environment, which Billy will get into shortly. And then also we have partnered with Health Resources in Action and the Massachusetts Asthma Action Partnership that have done some more expansion of the sensors to the east. So I will pass it off to them to talk about their work and how it's been going.
Great. Well, thanks. Hi, everyone. So the Hitchcock Center is located in Hampshire County in Amherst, which is kind of in the middle of the Connecticut River Valley in Massachusetts. And as Francheska said, a lot of the sensors started out in the southern part of the valley in Hampden County, centered around kind of Springfield and Holyoke. And, we've really worked to expand the coverage further up the River Valley and up to kind of I-91 corridor into Franklin County. And, in Franklin County, that's kind of along the kind of Route 2 corridor, east and west. And the idea was to really provide more coverage in some of the more dense areas like Greenfield, but also up into the hills a little bit in towns where you tend to see often kind of temperature inversions that concentrate air pollutants. And then also to the east into the what's called the North Quabbin region, just north of the Quabbin Reservoir. And the idea there that, again, that's an area that is along the kind of Route 2 corridor and has some of these higher elevation towns and small towns that hadn't been included. And so what we've done is in Franklin County, particularly working with this group called the Franklin Regional Council of Governments, which is a group that serves the whole Franklin County region. And in particular, we've been working with health departments in the various towns, as well as town organizations, libraries and schools. And in the North Quabbin region, we've been particularly working with public libraries, as well as some of the schools and community organizations in those smaller towns. Chrissy, do you want to add anything since you've been out installing some of those sensors?
I think I would just add that we're about halfway through trying to get those sensors installed, and we've had really good connections with especially town offices, and local libraries have been really interested in hosting those sensors and also doing some education to some of the community members up there.
Yeah, that sounds great. I think, the general approach has been trying to build relationships in the towns. It's not just about installing the sensors and, really contacting organizations and people who are interested in air quality and health and are willing to host the sensor. So with that, I guess, did you want to say anything else, Geri, about the Eastern expansion at this point? Or is
I think
that
we're
later?
gonna talk about our work after you guys.
Okay,
go.
great. Okay.
Thanks.
So the next thing I want to talk about a little bit is getting more young people involved in learning about and becoming advocates for better air quality, addressing climate change, and improving health. And we did a project this past year where we worked with about 15 youth from Western Mass and had them participate in a series of workshops learning about how they could tell their own story about climate change and how it's been impacting them. And some of those stories also touched on air quality. And these teams then recorded their own stories using a phone and a microphone, and then we had someone transcribe those interviews and pulled out quotes and took photographs of the teens and created a set of posters that are now up in an exhibit at the Hitchcock Center, and they're also on our website. What's really interesting is that these teens, even in their short lives, they were, say 14 to 18 years old, they talked about changes they had seen in the climate and in the environment in their own lifetimes, and talked about their concerns about the future and how they were involved in trying to take action and really encouraging others to take action. So this project was funded by this group called Mass Humanities, which is a statewide organization, and we work with a great partner, the Climate Stories Project, that has a whole methodology for doing these workshops. And we had a community event at the Hitchcock Center a couple of weeks ago, which was really great. We had about 100 people, teens and their families, but also community members and their friends, and we had great conversations happening about climate change and air quality and health and local impacts and what people can do. And this was a great project and something that we hope to continue in the future. It was really, really impactful. And Chrissy, do you want anything about that, since you were pretty deeply involved?
Yeah, the one thing I will add is that we just recently put out an evaluation survey for the teens to fill out, and I'm starting to get all of those responses. And um, just like a data evidence of how impactful this project was for a lot of them, and how important it was for their just growing ability to just talk to family and friends about climate change, and making them feel a lot more empowered to have those conversations, which I think is just a really important, sounds very simple, but just a really important starting place for everyone being able to talk about some of these issues. So it's been fun to see those responses and see how much they have changed throughout this project.
Yeah, thanks.
Yes, hello everyone. Thank you so much. Again, my name is Geri Medina. My pronouns are she, hers. I'm here with my wonderful colleague, Destiny Gonzalez. And together we help lead the Massachusetts Asthma Action Partnership, or MAP, which is a program of health resources in action, or HRIA. We love our acronyms. But HRIA is a public health institute that's based in Boston. And since 2009, we have been organizing MAP, which is a statewide asthma coalition across Massachusetts, and is actually the only statewide asthma coalition in the state. And as part of our work with MAP, we really bring together a variety of asthma stakeholders across Massachusetts to work to address asthma disparities. And a lot of the work that we do are really looking more at the upstream factors that impact asthma. And so things like air quality, looking at healthy schools and healthy housing, looking at policies and practices that can help reduce asthma disparities are some of the key focus areas of the work that we do. And as part of that work, we work very closely with the Massachusetts Department of Public Health in their asthma bureau. And with them, we created what's called the Strategic Plan for Asthma in Massachusetts from 2022 to 2026, which is basically a 5-year blueprint for the key focus areas and the key initiatives that we really want to lead. And as part of that strategic plan, we identified air quality and the disparities that we see in many communities in Massachusetts that have higher proportion of folks living with asthma, as well as environmental burdens. And so as part of this aim to reduce some of those asthma disparities and think about air quality, we wanted to partner with the folks from the Public Health Institute of Western Mass and Hitchcock Center for the Environment on this air quality project to bring in communities that want to lead community air quality monitoring initiatives in their neighborhoods. And so with an EPA, Environmental Protection Agency grant, we are currently funding 3 community-based organizations to do air quality monitoring in their communities in the state. And in particular, we really wanted to work with groups that were outside of the regions already represented through the Healthy Air Network. So we're really excited to say that we are currently funding 3 groundwork trusts. I don't know if folks are familiar with Groundwork USA. They're an amazing national organization, environmental justice organization across the country. And they have 3 trusts in Massachusetts. One in Lawrence, Mass, called Groundwork Lawrence, one in in Somerville, Massachusetts, called Groundwork Somerville, and then one in New Bedford, Mass, called Groundwork South Coast. And so each of these 3 organizations are receiving $30,000 each over a 3-year period, or 2-year period, funding period, to install 10 sensors across their communities. So they're really each leading. Yes, and it's good to see Dr. Hoffman, Jeremy Hoffman from Groundwork USA. Thanks for being here, Jeremy. But Each group is really leading the outreach to recruit host sites for these outdoor sensors and hopefully using the data that they're collecting from these sensors in their community towards some kind of, whether it's education, communication efforts to educate their communities around how air quality might be impacting folks' health and what folks can do if there's poor air quality events, and potentially some advocacy efforts as well. And, you know, as being part of this project, we're excited to feature them on our website. All the sensors that they install are up on the map. And as part of being within this grant program, we're also supporting each of the trusts with installing the sensors and technical assistance and capacity building support, which have at this point looked like supporting them explicitly with the sensors, and if there's any troubleshooting, thinking about recruitment and how, you know, they can reach out to different folks to get them on board to host. And then we're also thinking a lot about communication and are there materials that folks can use easily and adapt easily if they want to educate with their communities on air quality and how air quality impacts health. I think we can actually go on to the next slide. Thank you so much. And just a few quick updates on our end. We are actually excited to say that as of this, about a little bit before this meeting, we've actually installed 25 sensors across Somerville, Lawrence, New Bedford, and Fall River. So Groundwork South Coast just reported to us before this meeting that they were able to install 2 additional sensors this week. And our goal is to have 30 sensors from the Groundwork Trust installed. So we're really close. We're just 5 away. So we're really excited. And here, I know this slide is probably pretty tiny, but you can see where all of the sensors are located. You know, we really worked hard to try to put sensors well represented across each city so that folks are able to collect data from various transportation hubs or corridors, whether it's a highly residential area or a more urban area. These are some of the things that folks were thinking about as they were recruiting places to host sensors. So really excited on the progress and the hard work that the Groundwork Trust did. This is a lot of work to recruit residents to host sensors. And then I mentioned a bit about communications, but we're going to be hosting a communications training, not just with our Groundwork Trusts, but this is something that will be open to anyone who is on our Healthy Air Network. So if someone has a sensor on our network, they're welcome to join this communications training that we're going to be hosting on May 21st. It's going to be virtual. And I think Destiny will drop a registration link in the chat if you are interested in joining, but we're gonna explore how we can communicate you know, public health and around air quality. So how does air quality impact health, and how can we look at poor air quality events or the air quality index, right? To tell folks, to help folks navigate what that means and what they can do to protect their health. And then finally, MAP hosts an annual asthma summit that we work to host in person every year. And this year, our focus is going to be on air quality. And we're really excited to say that the Healthy Air Network is going to be our keynote speaker. And we're going to have a variety of breakout sessions looking at the relationship between asthma and air quality. And we're excited to say we have some folks from Transportation for Massachusetts joining us, who's going to talk about the advocacy work that they're doing around transportation justice and bringing cleaner, more sustainable alternatives to transportation in Massachusetts. They're going to do a session. We're going to have an expert from the Boston University School of Public Health who's going to talk about indoor air quality and the work they're doing monitoring indoor air quality, especially within schools. We're going to have a do-it-yourself air filter workshop and demonstration where folks can build their own air filters for free. We'll provide the materials and more. But this in-person summit is going to be on June 12th at Clark University in Worcester, Massachusetts. And we'll drop the link in there if you would like to join us. It's a free summit that includes food and really wonderful folks. You can register and join us on June 12th. And hopefully we'll have our groundwork trust there as well. And I think that's about it. But if you have any questions, feel free to put it in the chat or message me directly. And yeah, so great to be part of this wonderful project.
Okay, I'm going to talk just a little bit about the State of the Air report that just recently came out from the American Lung Association. If I'm just going to cover some of the highlights from that report, and there's also a recent report from the Massachusetts Department of Environmental Protection. Again, an annual report on air quality. So the Lung Association report, I believe, covered about a 3-year period. I think it was 2021 to 2023. And just a few of the highlights here. One is that in general, air quality in Western Mass is better than many other regions of the country. I think air quality in Massachusetts is generally pretty good, with some exceptions. But one of the things that we're seeing is the impacts kind of both directly and indirectly of climate change. So we're seeing longer, hotter and drier summers, and more heat tends to be associated with worse air quality. To some degree, that's because of increased production of ozone from vehicle exhaust primarily, but also we're seeing more impacts of wildfires and brush fires, whether they're distant ones, as we saw a couple of summers ago with wildfire smoke coming all the way from Canada, and also more locally, local brush fires. And a couple things to remember are, one is that the impacts of poor air quality are not felt equally by everyone, and part of that is folks who are particularly vulnerable are more likely to be impacted by bad air quality days. And, you can be more vulnerable because you're very young, or you're very old, or you have existing respiratory conditions. Could be asthma, could be, COPD, for example. But also the impacts of outdoor air quality are really on top of whatever impacts you might already be experiencing from indoor air quality. So if you're living in housing that has mold, for example, or dust or other allergens, and you have asthma, then that is already kind of elevating the health impacts that you might experience. And then on top of that, if you have bad outdoor air quality, that really compounds the problem. And then one of the things to remember as well is that a lot of the bad air quality days that we see in this part of the country are really due to a heat wave of a few days, or wildfire smoke impacts, and those elevated air pollution days really are coming on top of whatever kind of average baseline air quality we see. And generally, the thing we need to keep focused on is keeping that baseline air quality good. So that has to do with kind of larger changes in how we get around in terms of transportation. We're going to be talking about that. Really reducing the use of gasoline and diesel combustion engines, more alternative fuels, and also more public transit are really going to help keep that baseline level low. I just see, in the chat, there's some link about Springfield, that really has been, a real hot spot in terms of air quality issues. And there's generally been some improvements in air quality, but as the climate changes, we continue to see more of these impacts coming from that. So I'm going to stop there. There's a lot of data in these reports if you really want to kind of dig into it, but we're not going to dig into all of it right now. But if folks have questions, please speak up or drop something in the chat.
Right, so I'm going to carry on from here and share some of the results that we've been able to obtain from the huge number of sensors that we now have operational.
Krystal, before you get started, would you please introduce yourself?
Yes, of course. So I'm Krystal Pollitt. I'm an associate professor at the Yale School of Public Health and have been so fortunate to work with this amazing group on developing the Healthy Air Network over the past many years now. So as we dig into this data, because there's, as Billy mentioned, really a very dense data set that we've been getting. So measurements of PM 2.5 mass concentration every 2 minutes from each one of these sensors. We've been looking at what are the characteristics of the sensors that are consistently reporting higher levels and those that are consistently reporting lower levels, just to glean insights. Are there emission sources that are contributing? How do these levels change over the course of the day, over the course of the week, and over the course of the year? So we've taken about about 15 top locations that had the highest PM 2.5 mass concentrations and the bottom 15. And we've started here. So I've plotted here on the map those that have these differences, highest in red, lowest in blue. And you can start to see some pretty clear clustering that's emerging immediately from just pulling the data off in these two broad categories of highest and lowest. Highest are clustered around downtown Springfield, around Chicopee, and then we also had a more northern clustering as well around the Greenfield area, which is interesting. And then when we turn to, oh, I've lost the slides. Can others still see them?
Hold on, we will find that out. It looks like Francheska got bumped out, so hold on just a
Okay,
minute.
I can share also on
Actually,
my.
why don't you share if you can share real quickly,
All right. Okay, can everyone see that now?
Yeah.
Okay, excellent.
Thank
We're
you.
back in action. So, oh, let's go back to this map. We can see that the locations that consistently had the lower levels were Westfield, East Longmeadow, and then a scattering of some other communities that were dispersed. So that in itself is a really interesting takeaway of what's high, what's low. And then we started to tease out the data to say, how does it vary over the course of the day? And we looked hour to hour what the changes were. We call this diurnal variation because then this gives us insight. Are there consistent emissions that we can start to track down that are always happening at certain days? And they looked at how does that change over the course of the year. So I'm going to scroll through a series of plots that show the concentration, so the PM 2.5 mass concentration in micrograms per cubic meter. And on the x-axis, we have the average concentration over the course of the day. So what the levels were average every hour from midnight to midnight every day. And then we did this over a series of months. We looked at the summer and then the fall and through the winter. And the lines that are shown in red are those the highest sites, and then the levels are shown in blue for the lowest sites. And say we're going to start off in July of 2024, and we see that these sites don't really have too much of a difference, despite them consistently reporting low or high. But as soon as we start tracking through the fall, as the weather gets cooler, the trends start changing between the sites. And this is really interesting. So we start to see as the weather cools, we see this clustering of all of the higher sites, irrespective if they're of Greenfield, if they're in Springfield or Chicopee. And they start to have this peak, this rush hour peak that emerges around 7 to 8 a.m. and then also towards the end of the day. It gets more interesting as we start going to the colder periods. It becomes intensified with this more of a pronounced difference between the sites in December of 2024, and then it remains as the weather is cooler through January 2025, and then a little bit less, the weather starts warming, less pronounced again as we go, the weather warms further in March. So we're definitely seeing a transportation related signal that's causing that morning and evening rush hour peak that's intensifying the differences, that's consistent in all of the areas that are higher, and we do not see that signal for the lower sites. So that's a key takeaway, is that we have this transportation related effect that's dominating the higher sites. So then we also looked at, how do the levels change during the week? Like, is a Monday always the same? Do we see that there's differences between Mondays versus Wednesdays or over the weekends? And so we did the same type of thing across a series of different months. So we did January, February, March of 2025. And we took the average levels for the highest and the lowest sites. And we're starting to see differences between the two. So if we always look at the sites, we see that they are really similar during the middle of the week. But as we start going to the ends of the week and the weekends, that's when we see many of the differences arise. So pretty similar, pretty flat levels, consistent levels across the lowest sites. But these elevations come Friday, Saturday, Sunday, Monday, really are amplified in the higher sites. We see a slight shift in where the higher levels are as the winter continues, and then some slight shifts further as the weather becomes a little bit warmer. So we're just trying to think, why are we having these differences between the site types and even the warmer periods between the different days of the week. So that's still a big question that we're looking at, but we are clear from this data that there's a transportation component, but now examining how traffic variation might play out and impact days of the week is something that is of interest. So lots of data, and we'll continue to report more analyses as we were able to go through them.
Krystal, there's a question in the chat about, is it the cold air that the signal is so much stronger during the winter? Is it the cold air impacting it?
No, so the sensors are agnostic to the measurements with the colder air. There's meteorological phenomena that can impact the different air mass movements, so how the air moves across the region. That could play into it. So we could have types of inversion impacts that could be predominant more in certain times of the year. We haven't brought in those specific wind speed movements to couple in with the data yet, but that's certainly something that we could start pairing.
There's another question of whether the proximity, the communities that had higher levels, is it some proximity? It looks like they're on 90, they're on the Connecticut River. Does it matter? Does the river matter?
So the valley effect in terms of the meteorological events with inversions, yes, that will play a role. But we also know that in addition to just the topography, we know that the land use is different by the river too. So I think there's a mixed signature in terms of how do the emissions vary as you move closer to the river versus further away. So that's another thing to tease out, but a great point.
Are there any other questions for Krystal about this, with this data? Any surprise, any thoughts?
Yes, I have one. Stephen Howard. Good afternoon, everyone. I noticed from the chart that was just presented, the first one that was put up, when you look at the highest rates, you'd notice that it was where two interstates intersected. So I was wondering if the amount of, yes, you see down to the bottom and then to the top, like Greenfield and then the Chicopee Springfield area, you see those highways intersecting. Now, how does that play not only in part, excuse me, of the intensity of the pollution, but when you think in terms of the amount of traffic during the beginning of the week as opposed to the end of the week, as I think the last graph that you presented shows. Thank you.
Yeah, that's a really important point. So based on the clustering that you've highlighted and the interstate density in those areas, that's what prompted us to look at the hour-to-hour variation. And that really clear morning rush hour signal being so pronounced, and then that second one in the afternoon, that's a clear traffic contribution. And it would be now the next steps to link that if we have vehicle counts and if there's any differential vehicle counts as well. So can we parse out, is it more heavy duty diesel trucks on the roads that's driving that? Or is it personal vehicles that's really contributing to it?
Thank you.
Thank you. And we will be posting these slides on the Healthy Air Network website. So those will be available for review. And if you go onto our website, there is already, we already have several analyses that Krystal and her team have done. So if you could, we can drop that link in the chat to see the data that's already, the analysis that's been done in the past and what Krystal is doing with this additional data. So thank you very much, Krystal.
May I
And
just
I'll put
add
a link in
something
the
real
chat.
quick?
Was there
And
another question?
yes, it's basically more like a statement. The $47 million which was cut back from Springfield by this administration about a week or two ago, that money was basically to help with the air filtration in the schools. And most of that money was spent. But now since the unspent money was being pulled, the state is trying to see what they could do to make sure that those works continue and reimbursement come at a later date. So when you have things that are addressing our children, especially in schools, being, pulled by these cuts, the question is why? Thank you.
So we're going to talk about that in a minute, but I will just say this is definitely one of the challenges that we are facing right now, which is that this work has been supported by the EPA. Several of our organizations, Public Health Institute has had an EPA grant in the past, Hitchcock Center and Health Resources in Action, and those grants are in jeopardy or have already been terminated. So we do know that there are cutbacks now, and so the data that we're collecting here is really critically important. So we are, well aware of what the Asthma Coalition has been working for years and has made some progress on. We can, through the work that we've done, we've seen asthma rates and asthma outcomes improve over time, and we're seeing that and fearing that those wins are going to be creeping back up, just like we've seen with air quality. There's been improvement and it's creeping back up because of climate change impacts, and we fear there will be more impacts going forward. as we move away from the focus on reducing greenhouse gas emissions, reducing use of fossil fuels, et cetera. So we could talk. I have some graph or some data a little bit further in the slide in the presentation to speak to that. But I'm going to turn it over to Francheska to talk about what we've learned because of this impact on transportation that we know as part of this. We have gotten a grant from Transportation for Massachusetts to look at transportation and air quality. And we recently did a workshop with our resident advisors. And I'll pass it to Francheska.
Yeah. So in this workshop, we had a mapping activity with the resident advisors to map where they perceive transportation impacts air quality, and also propose new sensors. So they annotated the map, they put certain colors for high truck traffic, car traffic, bus depots, anything that they can think of that can be polluting and impacting air quality, and then proposing where to put new sensors. So this is very Springfield Holyoke focus, but just wanted to show that we held this activity and the resident advisors have picked areas where we don't have any sensors at the moment. So in the teal blue of this map, you'll see our current sensor list. And the purple is where the proposed new sensors they would like to see. So we have some ideas of where to put some. And so in the next upcoming weeks, our team will be looking at doing outreach and deploying more sensors in these areas. Just wanted to highlight that.
And so the other part of our other work with this funding and looking at, well, what do we do about the outdoor air quality? We looked at transportation. One of the big pieces that we want to focus on is the funding for regional transit authority. So this is for the bus system in Western Mass. And so we worked with our resident advisors. Our resident advisors are residents from the communities, mostly from Holyoke, Springfield, and Westfield, who are providing guidance and helping us plan and understand our project. And so we just did an advocacy letters to our where the resident advisors wrote letters to our state representatives and senators to support funding for regional transit. We've at this point, the House has just put in their funding request. We have been advocating for increasing that funding request. And then we'll just keep following the process, because one of the important things is, first of all, it's a transportation justice issue to have public transit available. But we also know that anything that can get people out of cars into buses is a good idea. The PVTA in our region has been working very hard on decarbonizing their fleet, and so supporting that as well. So it's all about funding to increase availability of service, reliability of service in the region, as well as making it possible for them to continue on this path to decarbonizing regional transit. So that's one of the advocacy points that we will be supporting through this work, and it ties right into what we're learning. What you just saw in the data was we've got to do something about transportation. So that's one piece. And moving to our next slide, we're looking at two air quality bills. And these have been brought forward with support from the Massachusetts Environmental Justice Table. And you can see all the organizations who are involved, including Groundwork Lawrence. And so these air quality bills are really the next step in encouraging the state to take action to understand better what the air quality is in the state. So if you go to the next slide, you'll see there is an outdoor air quality bill. And this is to establish a technical advisory committee to identify air pollution hotspots. Of course, we'd love to work with them because we have a lot of data here to bring to the table. And enhancing the air quality monitoring in those spots, we know some of that. We'd love to see more of that. And then looking at solutions like air filtration in buildings near major pollution sources. So say some of those schools that are really need good ventilation, and setting air pollution reduction targets, and to encourage DEP to track and publicly report air quality data in real time. You saw we got the report from DEP that was from 2023. We love the work that we're doing because it's trying to get more air sensors so that you really have local data in your neighborhood, in your community for air quality. So that is one outdoor air quality bill. And so if you sign up to be on our newsletter, you'll get regular updates about these when it is the pivotal moment to make those asks and requests to our legislators. And the next, so separate from the outdoor air quality bill is an indoor air quality bill. And we're, even though this focus from the Healthy Air Network is really on outdoor air quality, it's really important for indoor air quality because, you know, air doesn't stay just outside, it goes inside. And again, a statewide task force to develop clear guidelines on addressing indoor air pollution, and in particular on mold contamination. One of the other effects of climate change is increased and more extreme storms. So we all know that the rainstorms are just, it feels tropical sometimes here, where the kinds of rainstorms we're having. And for homes that are older, we have a very old housing stock and many rental properties that have not been kept up. And so just really important to address those water issues that are being exacerbated by the climate change impacts that we are seeing. And so this is another, so having these task forces to really, for the state to focus on this would be really, really amazing. So you'll be hearing more about these. We'll be working with the EJ table to be sending out some of the alerts around that work. And then I just want to go back to what we were talking about before. Asthma outcomes have been improving. If you look at this chart, this shows hospital admission rates in Springfield, comparing Springfield to Massachusetts. You'll see that the decline in Springfield has been quite, over time, is quite impressive. And so that, at the same time, there's a little bit of creeping up, and we know because this data ends in 2022. We know that the most recent Asthma and Allergy Foundation report that was referenced in the chat by Stephen Howard, that report showed us back up at 4, even though the data has really come down since 2018, 2019, when we were number 1. And when that speaks of Springfield, it was not just speaking of the city of Springfield, it was talking about the whole region. And so that is for Hamden, Hampshire, and Franklin County, that data, and that asthma capital. It was not just for the city of Springfield. And so we see that cuts to work like our Healthy Air Network, work like the programs in the schools, the cut to the grants to do more education and addressing asthma triggers in schools, cuts to the Healthy Homes program that was just really announced. Those kinds of cuts put all of the gains that we've made at risk. And we also know that with climate change, these will continue to get worse. So it is definitely a moment of thinking about what is the next step. And we don't really have answers. We just know this is where we're, this is what we're seeing. And next slide. So are there any questions? I think this is the moment where we can open it up. Are there any other questions? And Geri, I don't know if you want to speak to what you put in.
Oh, yes,
I
just go ahead.
I'm sorry, there's another Geri.
Go for it, other Geri.
Thank you, other Geri. You guys, you're awesome.
I second that.
I in the chat, I put the beginnings of what I've been trying to do in collaboration with Mass Climate Action Network. You might want to look at the recording of a presentation that we had with a talk by Bill Landrigan, who is Mr. Toxic pollution and what it does to people, and he's been working on this for over 50 years. And so he gave us the science, and then we talked about ideas of going forward. I'm looking to you people to guide us and be an example. I'm so grateful to hear what you've been doing. Thank you so much.
Thank you, Geri.
Thank you. I other Geri. So fun. I don't know if you had been, or sorry, Stephen Howard, just adding in some of the federal funding cuts, especially to schools. And I think I just added a comment there that we, as part of our work, right, through the Massachusetts Asthma Action Partnership, we had received funding from the EPA to build on some of the healthy schools work that we had been doing for the past 2 years, where we were funding 3 Massachusetts public school districts to make infrastructure improvements in their school buildings to improve indoor air quality and other environmental health issues. And unfortunately, that funding was terminated by the EPA about a month ago. But for us, we have applied to some state funding opportunities and are kind of waiting to see, how the state responds, or if there will be future funding opportunities more locally, including state, but also municipality level. But it's certainly it's really, really sad. I know a lot of organizations have been facing terminations, challenges to accessing federal grants. So we're kind of waiting and seeing how the field will look. And for us, I mean, we're just hopeful that we can continue doing work, looking to see how this can look in the absence of federal funding. But thank you for raising that in the chat. And when we're thinking about air quality, it's important to think about the indoor air quality as well. So and this aging infrastructure, both in homes and schools. So really appreciate engaging in that topic in this chat.
So we invite people to help us with hosting sensors. So we do have a number of sensors ready to be placed. They've been calibrated by our Yale team. So part of the reason that we're able to give good quality data is because our team at Yale calibrates those sensors, and so that a low-cost sensor can actually give some really good readings. So we appreciate the work that they do. And so here are some of the locations. And then, I know there's some interest in perhaps in some in Northampton or Hadley along that I-91 corridor. If there's anyone who would like to host a sensor, if you would follow up with Francheska or myself, and we can work on making that happen.
Here are some upcoming events that we will be a part of that, or some were already mentioned. So our network of air sensors are great, but they also come with some troubleshooting, and sometimes they're offline. So we are hosting various air sensor maintenance days to make sure that these sensors are up and running, as well as deploying some of the new ones. So if anyone would like to learn more about how to do this or have any questions or would like to join, let me know and follow up with me. And then again, the Health Resources in Action Communication Workshop will be on Wednesday, May 21st. It'll be virtual and it'll be open to our censor hosts and folks in our Healthier Network group. And then as well as the Asthma Summit in June. So hope and that's open to anyone who would like to join. And I believe Destiny or Geri put the link in the chat for that. Stefan, I see that you have you raised your hand.
Yes, I was wondering, is there any way these meetings could be virtual rather than just having one of the 6 being virtual? Because especially for seniors who may not be able to attend because of their lack of mobility, they'll be able to be informed. And since some of them are very active, it will be a way for them to, say, reach out to especially state representatives and senators to make sure that the pressure is applied. So when these bills come forward, you know, if folks are not aware of it and if they're not putting pressure on these elected officials, you know, they may have figured, well, you know, these people don't know about it anyway, so why am I going to go out there and, you know. Thank you.
Thank you. And one of the things, this doesn't include the fact that we do presentations. So I just want to say Francheska has a fantastic roadshow. So if there are any organizations that you think would be willing to host or would interested in hosting a presentation, we've done virtual, we also do in person, and we can do that cool demonstration of how you build your own DIY air cleaner for your house. So we've done that a number of times, and I believe Francheska has a few lined up for this summer. So we're very excited to do that. Just contact Francheska or myself and we can get that organized. We do have one other question in the chat. While you're doing your webinar evaluation, we really like to get feedback so we can know how to do a better job next time, what you like. Please either you can use the QR code or you can click on that link. Krystal, while they're doing that, can you give there was a question about pollen, because if winter and summer are the worst for air quality, but pollen seems worse in the fall and the spring. Is it just if it's just a different modality? There you go.
Yeah, pollen's a great question. The sensors that we are using are not the best to be evaluating pollen. So pollen's quite large in size, and we have a certain size range that we're good for studying. There are other means that we can capture pollen better for, so I wouldn't strictly be relying on these measurements to be also indicative of pollen.
And just to note that we do on the sensor card, if you go to the Healthy Air Network and you look at the sensor in your neighborhood, in addition to the particulate matter readings or ozone readings, we also include pollen data and weather data. So we're trying to put it all there on the page with it, and we do have some pollen education on our website for our asthma coalition and for healthy air as well. So that's a great call out. We will definitely include more on that, but it's not quite the same as what the sensors are tracking. Okay, well, I think we're at a close. We are at time, so thank you, everyone. I know there are a few more questions, and if you want to stay on for those questions, we'd be happy to do that, but we want to let everyone go. We will be sending out follow-up information and definitely information on how you all can get involved in some of these advocacy efforts. And thank you so much for joining us today.
Thank you.